Thank you very much, dear colleagues. Thank you for joining the closing session of this conference, co-organized by International Disability Alliance, ILO, and UNICEF, together with the Asian Development Bank, Australian Department for Foreign Affairs and Trade, GIZ, HelpAge, the Joint SDG Fund, UK FCDO, UNESCIP, the World Bank, and with financial support from UNPRPD, DFAT, NORAD, and the EU-funded Project on Social Protection and Public Finance. Before we proceed further, let me just mention that there is simultaneous interpretation. There is international sign language and closed captioning available. So we started by brief presentations of the normative framework and global state of play and key issues in different regions. We heard about the key ask of organizations of persons with disabilities from different regions and the experience and efforts from more than 20 countries from all regions to address existing gaps in building inclusive social protection systems. In this closing session, we will reflect on the financing gap globally to achieve universal social protection support for persons with disabilities, and we'll hear from leading experts and organizations about some of the priorities ahead of us. Our first presenter will be Alvaro Chavez from ILO. He's a technical expert in social protection financing. Alvaro will present the key figures related to disability from the ILO financing gap analysis for SDG 1.3, highlighting the gap in coverage in financing. Alvaro, I'm handing it over to you.
Good afternoon, college. May I have the presentation? Thank you. So we are discussing within this panel on the way forward. What is the role of closing the gap for universal disability social protection support? And in particular, they require an effort to quantitatively estimate the financing gap. Next slide. Thank you. So a measurement of financing gap in social protection was developed initially in a paper by ILO in 2019. And this exercise was repeated in another paper in 2020 to add COVID-19 effect. In fact, some of you may have seen this number before, but now they are somewhat larger due to COVID-19 effect. This effort on financing gap was linked to all benefits related to social protection. This, of course, included estimating the financing gap of the disability benefit in particular. However, this effort on estimating disability benefit had critical assumptions. One of them was that the study considered working age adults with severe disability. You all know perfectly well, there may be other adults that need support with milder disability, but it was not possible to estimate this for now. Second, the disability benefit is 100% of the national poverty line. In other words, it was a simplified way to estimate what would be the financing gap to provide every working age adult with severe disability with a disability benefit that is equal to 100% of the national poverty line. So the authors acknowledge that they do not account for the diversity of disability-related costs and it doesn't account for adequate coverage of children who may receive child benefit or older person who may receive older person benefit, but disability may increase the cost of living, so they may require supplementary disability benefit. They were not taken into account either. Next slide, please. Thank you. So overall, the current worldwide coverage is roughly 18.5% of an almost 200 million working age people with severe disability in low and middle income countries. This study did not include advanced industrialized economies either. So I may note that this level of coverage is much lower than, for example, old age benefit for people. So this also will increase significantly the financing gap relative to the number of people in total that have severe disability. The result in absolute number in terms of US dollar came out at almost $10 billion for low-income countries, universal disability benefit coverage, and for middle-income countries, another $190 billion. However, in terms of the percentage of GDP that this represents for low-income countries, this is roughly 2% of GDP. And for middle-income countries, between 0.6 and 0.7% of GDP. So worldwide, because middle-income countries are a much larger part of worldwide GDP, then the financing gap worldwide came out to closer to 0.6% of GDP. Let me remind you, this is the financing gap, in other words, the amount of money that is required to complete coverage between what is available now for people with severe disability and the amount of money that should be available for them to reach the minimum level of poverty, or at least to go outside the poverty level in this country. Next slide, please. Since most regions have a mix of very poor country and middle income country, you may see that most regions are somewhere in the middle between the 0.6% and the 2%, with exceptions such as Eastern Europe, which tend to have much higher effective coverage of people with disability. So as you can see, some of the greatest challenges we can find in Latin America and in Northern and Sub-Saharan Africa that would require up to 1.2, 1.3% of GDP. So I also may add that we are currently working on country level numbers, but they are still in the process of being refined and peer reviewed. So we will share them opportunity when it is done. Next slide, please. What have we learned from this effort? First, that despite recent progress, there is a scope for greater comparability of data prevalence of disability between countries. It is not uncommon to find countries that seem to have much higher disability, severe disability prevalent level than other countries. And there isn't an obvious reason why it would be the case, apart of possibly lack of standardization on how to measure the prevalence of disability. Second, even if the disability itself is properly measured, we also have scope for improving the budget expenditure classification. In other words, if we are trying to figure out what is the financing gap we need to know how much is being spent right now. And unfortunately, many countries they make a big effort to spend money on people with disability. They are not necessarily classifying this money in a clear budget line related to disability. For example, if the country is engaged in classification by functions of government, there is a specific line named the 7101. This one would allow us to immediately identify expenditure as disability related, and most countries do not use this specific line or method. Then also, it would be convenient if we develop further the ability to distinguish supplementary disability need in child benefit and old age benefit from working age disability benefit. And finally, costing, and this is the importance of costing and measuring the financing gap, may reveal the extent to which benefit at the poverty level or above it are realistic. Sometimes due to cost, country might aim for lower than poverty level benefit, which may not solve poverty situation, but partly close the poverty gap and reduce the severity of it. Next slide. Thank you very much for this space, and I hope it yields a fruitful discussion on the future and the way forward for disability benefit. And any information you may require, please write to me. Thank you.
Thank you very much. Thank you very much, Alvaro. I'm going to open the first round of questions for Sharah, Razavi, Natalia, and Gustavo on key issues to be considered and explored further to progressively close the gap. I want to thank Alvaro first for sharing the data showing there's a need to step up financial and social protection as a key vehicle for inclusion of people with disabilities. So we've heard many examples of countries that have made impressive progress in this regard. So my question to Sharah would be, traditionally social protection has seen disability from the perspective of incapacity to work, but is now seen as an essential tool for supporting socioeconomic participation. What are the key changes that this imply, particularly for working age adults and older persons? Sharah,
yeah, thank you. Thank you very much, Shuaib, for posing the question. And it's great to be part of this panel and to be sharing it with other colleagues. And it was great to hear Alvaro before giving you a few kind of issues that I think come out quite strongly that we have been hearing, throughout this conference about the sort of key lessons that are really crucial to ensure that social protection policies and systems are really working towards the inclusion of people with disabilities, and in particular, as you mentioned, those in working age with disabilities. And let me just highlight, if I may, 5 key points that I think have come out quite strongly. First, I think, at the ILO, we always emphasize the importance of universal approach to social protection to really be able to realize the right to social security, the human right to social security. And this, as this audience will know very well, but let me just reiterate it, we understand this sense of universal social protection in terms of ensuring that everyone has access to comprehensive, adequate, and sustainable protection over the life cycle, which is in line with the ILO and human rights standards. And disability is obviously one of the contingencies among the 9 life cycle risks that exist. And like health, it cuts across the life cycle. This means that needs vary across the life cycle, and needs also differ due to the diversity of circumstances that people are in and the diversity of barriers that they have. And also, very importantly, another point that has come out is that needs also vary according to the kind of disability that you have. So there's quite a bit of variation that's there. And social protection systems, therefore, really need to be responsive to the very specificities of needs and circumstances that people are in. And one size for sure will not do and will not fit all. So we really need to be responding to this kind of diversity. The second point, and I think it's really important to emphasize this, is given this diversity of needs, it follows that we really need a variety of mechanisms, including benefits and services to really be able to address and provide the kind of universal disability support that is needed. And while cash benefits are clearly very important here for income security to cover the disability-related extra costs, cash alone is not going to be sufficient. It's going to be equally important to really provide access to healthcare, rehabilitation, assistive devices, personal assistance, as well as access to other kinds of services, which may not be part of social protection, but where social protection systems really play a very important role in facilitating access to them, like early childhood development, education, and active labor market programs and policies, which really goes to your point again about the active age population. And we have to really ensure that these complementary services are accessible for people with disabilities. They meet their needs and they really ensure sort of inclusion of people with disabilities. So this really means that countries need to develop a very coherent long-term vision, which encompasses different schemes, benefits and services, and that comes together in a way that allows progressively for countries to build these into adequate support for all people with disabilities across the life cycle. And I really want to emphasize that this is a challenge, for all countries, and most countries have a long way to go to really get to this broad vision that we're setting out. And they need to really chart their own very context-specific pathways with their distinctive combinations of schemes and programs that they have, and build on these and ensure that the system is there for people with disabilities. The third point, which really goes directly with the point that you were raising about people of working age, for economic inclusion of working age populations in particular, it's absolutely important that we have benefits that are designed in a way that are compatible with employment. And this is, I think, a very important point to emphasize. And first off, I think we need to acknowledge that people with disabilities often face extra costs when they are employed. We've heard a lot about this during the conference. And we also know that people with disabilities also often face many additional barriers in order to find employment. So it's therefore really concerning that the vast majority of schemes that exist require proof of at least partial incapacity to work as a precondition for giving person with disabilities, to qualify them for benefits. Now, if those are the only benefits that exist, disability benefits that are available, it really poses an impossible dilemma and compels people to have to choose between either receiving their only disability support benefit while getting themselves locked out of the labor market, or entering the labor market and having to assume all of the costs themselves without any financial support and any additional benefits. So this is, I think, a really impossible and difficult choice to really be asking people to make. However, I think if societies do facilitate ways of combining both access to employment and having those benefits, they can really facilitate then access to decent jobs for people with disabilities much more effectively. And also this can produce what we call a triple dividend. Because people with disabilities in employment will need less support to cover their disability-related extra costs, because they will have some degree of income security from their jobs and they will need less income support. Secondly, they will make also their own contributions to social insurance systems, for example. And thirdly, they will also be generating additional tax revenues through the fact that they're now working they're employed and contributing also taxes to the fiscal and enhancing the fiscal capacity of the state. So designing support systems that are compatible with employment can be a very powerful trigger for this kind of virtual circle. And the fourth point that I would like to raise here is that support for working age people is not just a matter of economic inclusion. Economic inclusion is important. And that's why, I elaborated a bit about the ways in which benefits need to enable employment and not disable it. But equally important is the support that people with disabilities are able to receive to really be able to have independent living in the community and to be able to ensure their own personal autonomy and dignity. This is absolutely important and has to be emphasized. Now, the tragic events and the death rates that we've seen in care institutions and disruptions in family support systems over the past 2 years, in the context of COVID, I think have revealed some of the weaknesses that exist in the capacity of countries to provide effective support to persons with disabilities, across the life cycle. And there is also today a clear consensus on the need to move away from this kind of strong institutionalization approach to really support living in the community, independent living. And the latter is also closely related to the organization of personal assistant and other forms of support services that people will need to have that kind of independent living. And this is something which is critical at all stages of the life cycle. I'm sure Natalia will talk about that with regard to children, but also I think it's really important to say that for older persons who may not even self-identify as persons with disabilities, this is also important. And my last point here, and Shuaib, I hope you allow me to elaborate on this last point, is that provision of services for people with disabilities to really enable their independent living is not only important for them, but also it's important for their families, because in the absence of that kind of community-based support services, then usually what happens is that family members have to provide the care for people with disabilities in their families. And this very often entails having to forego, jobs, or having to take on jobs that are part-time or of more precarious nature, and therefore it sort of compromises their economic security. But also, very importantly, it also compromises the degree of autonomy that people with disabilities have if they have to rely on families, which may even expose them to the risk of abuse or neglect, compared to the situation where they can choose between different care options and where families also have different options and are not compelled to be the only care providers. And given that care is still by and large something which is provided by women and girls, then you can obviously understand that this has huge gender implications as well. And when societies do not provide the kind of quality community-based care services for people with disabilities, effectively what they do is they're shifting the cost to unpaid care providers who tend to be, predominantly women and girls. And finally, let's not forget that investing in professional care services that are regulated and formalized can also be a source of decent work. In most societies that are undergoing demographic aging, this is a growing need, and therefore this can be an important engine of employment generation as well. And in that way, I think it's another kind of positive payoff of investing in care services. And I'm sure Natalia will have more to say about this. So let me stop here. Thank you.
Thank you, Sharah. My next question is to Natalia Rossi, Director for Social Protection and Social Policy at UNICEF. Natalia, just a quick reminder to everybody that we have 5 minutes each for this segment. So let me just pose my question to you. UNICEF recent data show that while children with disabilities and their families have much greater needs for social protection, across the regions, they are not more likely to benefit from social protection. What are the key issues that need to be addressed to address this?
Thank you very much, Shuaib. I hope that everybody can hear me. Good evening, good afternoon. First of all, very excited to be here and to have the opportunity to share this closing panel with colleagues and friends from ILO and the bank. It's been an exciting couple of days with a very rich agenda. And as we collectively think on what is the future of social protection, I think this conference has highlighted some of the challenges, but also the very important opportunities we have in hand to effectively and systematically support persons and children with disability with social protection systems. Specifically on your question, yes, as you rightly point out, and as we know, children with disabilities do face additional and very specific needs, ranging from early intervention and rehabilitation, assistive technology, to specific access to critical social services, and of course, particularly looking at the first 1,000 days of life throughout the children's life cycle. And unfortunately, the limited visibility and attention and rapid attention to these continue to significantly increase inequality. So for example, the data you were mentioning highlights that children with disabilities are 30% more likely, for example, to be stunted, 49% more likely to have never attended school, 70 times more likely to be institutionalized, also more likely to live in poverty, to be engaged in child labor, or to be victims of violence. UNICEF is promoting a multi-sectoral approach to tackle those inequalities, where of course social protection is a key pillar of that approach and has a very critical role to play. And allow me to share a few elements of what we mean by this. So first, as part of our strategic plan, UNICEF continues to be committed to scale up and support the importance of closing the current gap that we have in social protection coverage. And particularly when we're looking at children, we know that only 26.4% of children globally receive any form of social protection. But as we scale up our commitment to the expansion along SDG 1.3, we've also committed to ensuring that these programs and systems are gender transformative and disability inclusive. This means, for instance, ensuring a progressive move towards universal child benefits, but also benefits that can factor explicitly disability and gender-related needs in their design and implementation. So we're looking at coverage, but also adequate coverage, tailoring programs to really make sure that we can address the specific and multiple compounding vulnerabilities of children, particularly in this case, children with disabilities. Moreover, I'm very much aligned to what Sharah presented just a minute ago. We also recognize the importance of strengthening the different components of a social protection system, including cash, but not only. So going beyond the cash-based interventions. And this means, for instance, enhancing specific investments for more inclusive childcare systems, enhancing modalities to cover the added cost of healthcare and health insurance that can really include rehabilitation and assistive technology, but also contributing to the development of community support services for parents and children and adolescents with disability. The second key point, I think that we still need to revamp our efforts, our commitment around evidence generation and strong data and information systems. I think it's important that we have much more detailed analysis of what is the scope and scale of the additional costs the family incur. What are those gaps? What are the differences between regions? And I think as we have been discussing in different sessions, as a collective, we've started some very innovative work in this area. And I think we have committed to continue to invest together with colleagues from the bank and other partners to really develop specific methodologies to measuring this disability-related costs, as well as the best policy scenarios to address the different barriers that we're seeing. And linked to this, the importance of mechanisms and modalities to further strengthen accessible, comprehensive, and reliable mechanisms to effectively reach children with disabilities and effectively assess the level of the support that they need. And this is, I think, crucial, right? And really make sure that we understand what is at stake to be able to design better policies and more adequate responses. And I think today we've heard about very promising practices in more than 25 country offices that are supporting the reform or the development of such mechanisms, really to enhance the early identification of a disability, which is, as we know, an additional challenge. Third, I think, and again, linked to the point of Sharah, we need to definitely do much more work in understanding what is the critical support required by children and families with disability, but without aggravating the already significant gender imbalance of unpaid care and its impact on women and girls. And I think we're still there. We still have some room to progress in this regard. I think it's important to know that we are initiating work with the International Disability Alliance, with OHCR, with the International Disability and Development Consortium, to really include a broad consultation with organizations of persons with disabilities, as well as their families, service providers, local central governments, to have a much more greater clarity on the needs and demands of support. And based on that, identify the most innovative approaches that are also gender sensitive and that can support community care in different contexts. And one last point, if you allow me, the importance to make sure that our programming is also adequate and relevant when we work in fragile humanitarian crises, whether in our support to make existing systems much more shock responsive and risk informed, or when we're working on delivering life-saving humanitarian cash transfer. In these programs, we need to systematically consider how to best address the needs and vulnerabilities of children with disabilities and their families. And this is one of the key things that I was able to see and experience in my current mission in Kabul, where children and families with disability are one of the most vulnerable groups in communities, and where the UN-wide effort is really trying to address those added costs and those extra needs, not only in targeting, but also when we're defining the different transfers that are being developed and implemented in this regard. So this definitely needs to be critical as we're thinking about systems development, adequate coverage, and more effective mechanisms to support children with disabilities. Thank you.
Thank you very much, Natalia. Thank you. The next question is to Gustavo DeMarco from the World Bank. Gustavo, the World Bank is supporting significant investment of governments in building social protection delivery systems. In which way those efforts can be amplified to expand support to persons with disabilities across the life cycle?
Thank you very much for your question and for inviting me to be part of this very important panel. Let me start by saying a couple of words about how much I agree with the previous panelists in the sense of highlighting the importance of having a systems approach to the support on disability and a life cycle approach for persons with disability. This has important implications, not only on the work we do, which as Sharah and Natalia have highlighted, is not only about providing financial support or cash benefits, but also it is about providing rehabilitation, education, developing skills, supporting employment and employability of persons with disability, developing the skills for that, and providing services, long-term care for the elderly with disability. Elderly in general, with aging populations, is becoming increasingly more important, but older people with disability particularly deserve attention. So this comprehensive approach has implications on the way we understand what are the gaps and what are the financing needs, because if we define the gaps by the number of persons with disability who are not receiving one benefit, it is not the same as to say that there are persons with disability that should be receiving several services. And we have to make sure that whoever receives cash also receives rehabilitation, so that the person can be able to work and receive the education and skills to be able to be employed and receive the long-term care services and health. So the gaps is a very challenging question, and I think many of the people who get who are asked to answer the question of how much more we need to invest, I would say, you know, it's such a difficult question to answer. We need to invest in human capital. We need to understand persons with disability And this is a way we see at the World Bank as investing in human capital. And it's also a cross-sectorial challenge, as Sharah also highlighted, that is not only of social protection. We at the World Bank have a core team of colleagues working on disability and inclusion. And this includes, of course, mostly the human development group, health, education, social protection, and jobs, but also infrastructure colleagues from other sectors as well. Delivery systems is at the center of the challenges of what we have. We need to do more. And this is about, first of all, a big picture framework, bringing programs together, making sure that the fragmentation that we see in the social protection for persons with disability, and that in some countries, I recently, I'm incidentally working on a program for Tamil Nadu in India, where 79 programs have been identified to serve persons with disability. These, in many cases, means that some programs do not know much about who is benefiting from other programs, do not talk to each other, do not coordinate. And this is the institutional and information sharing becomes very, very essential. The other thing is that in order to make an effective lifelong support to persons with disabilities, it's very important to strengthen the support to case management programs and MIS systems. The technology is becoming essential to support inclusion, to support accessibility, and to improve the chances of persons with disability to get into jobs. One thing that we have learned from the COVID-19 pandemics is that there have been enormous challenges, but there are also important opportunities. The world is moving towards forms of work where people are going to use increasingly more hybrid modalities of work, and this is it's paradoxical, but it's good news for persons with disability because it may open more possibilities, and we can raise the bar of what we expect about the inclusion of persons with disabilities, because in many cases and in many lower income countries where infrastructure is a severe limitation for persons with disability to access their workplaces, maybe reconsidered. So automated processes, management information systems, social registries are important among the delivery systems, but and also disability assessment. I mean, we had a session on this, and we learned about the importance of moving towards more effective, simplified ways of assessing disabilities and giving access to programs to persons with disability, the shift from medical to functional disability, which we are also supporting at the World Bank. But finally, let me say just 2 words about long-term care. And long-term care is as I said, an essential part of the support for persons with disabilities, an important way of promoting women's participation in the labor force. And it's a two-pronged approach. On the one hand, the more we can develop effective systems of long-term care for persons with disability, the lower the pressure for the women in the households to be the ones to provide some of the services that are required for the persons with disability, while at the same time, the skills that some of these ladies have developed working at home, supporting their children, supporting their elderly with disability, can become useful skills for them to participate in the labor market and to provide paid work for other persons with disabilities, which is something we are trying also to promote. I think I'm running out of time, so I will stop here. Thanks.
Thank you very much. Thank you. Yeah, we really gone over time. I just quickly want to say on behalf of the International Disability Alliance that what we've heard over the past few days now is a commitment from organizations of persons with disabilities to engage with governments and development agencies. It's a willingness, and only true change will come about when that is a meaningful participation by people with disabilities, and a willingness from governments and development agencies to meet that commitment coming from organizations of persons with disabilities. Now, I'd like to, before closing, give you the opportunity, the panelists an opportunity, Gustavo, and then Natalia, and then finishing with Sharah, just in 1 minute, some closing comments, if you wish to do so. Gustavo, would you want to start? You've got 1 minute.
Yes, thank you. I think I will follow my concluding remarks or comments following on my previous intervention. I think the extension of coverage is one of the most important challenge, the most important challenge that we have ahead. But the extension of coverage, as I said, needs to be supported on encouraging our counterparts, institutions working on disability to communicate better, to be part of networks, and to share information as much as possible. It's very important to know if a family that is receiving a cash benefit because there is a member with some sort of disability is also receiving other services. If children with disability are receiving something in addition to money, if they are receiving rehabilitation. Many times it happened to me in the past, you ask the institution that is providing the income support about rehabilitation, and they say you have to go to the Ministry of Health and ask about that. So people need to apply for different benefits in different offices, and this is something that needs to change.
Thank you.
Yeah.
Thank you, Gustavo.
I'll stop here.
Okay, Natalia, 1 minute.
Always difficult to close with 1 minute, but I think that we're in a critical moment, right? And we have a very important opportunity to enhance our collective efforts to close existing gaps. As I said at the beginning, coverage, but also adequate coverage and sustainable financing, and really make a difference in terms of really inclusive social protection systems. I think that we must recognize that there's no one size fits all. There are different pathways and context-specific solutions. In some contexts, it will be reforming existing programs to make sure that there are disability-specific schemes and services. In others, is enhancing the linkages with broader sectors, social and employment. In others, is trying to still finding the political will and space to include children with disabilities systematically in programs. But I think in every single context, even in humanitarian contexts, as I was saying, given what I'm seeing this week, there are entry points and steps can be taken. And I think these 2 days have shown that there's the commitment and the willingness from the different organizations that are supporting this process to make a change. I really look forward as UNICEF to continue expanding our cooperation with the disability movement, with the different colleagues across the UN family, as well with our broader collective here, which is really trying to move the needle towards a much more inclusive and effective social protection program for all. So I'll close here. Thank you.
Thank you. Thank you. Sharah, can you give us your comments in 1 minute?
Yes, Gustavo, I'll try and build on what was already said by the other two speakers. I mean, I think the issue that we've seen throughout this conference, this emphasis on the glaring gaps, I really want to say that the gaps, yes, it's in terms of numbers of people covered, but also in terms of the adequacy of the benefits, the range of risks that are covered, and the kind of services provided. So that kind of, we have to understand this idea of gaps in this broader sense, and also to say that we've also throughout this conference emphasized the need for not only having income security, but also covering disability related extra costs, covering healthcare costs, and making linkages to other services, and not having the kind of fragmentation that Gustavo was referring to. However, I think it's also, my last point, really important that in doing the work that we're doing on all these dimensions, the direct involvement of people with disabilities and their organizations as representing them in the planning, in implementation, in monitoring of social protection policies is absolutely crucial to make sure that all these 4 functions that was mentioned are properly and optimally fulfilled. And the last word, I really do want to say that this conference itself is a living proof of the momentum that has been created to improve social protection systems for people with disabilities. And I think the fact that we're having this interagency group of development partners together with IDA joining forces to really enable governments and organizations of people with disabilities and development partners to engage in this dialogue is a sign that I think we're on the right track. We have a long way to go, but I'm confident that we can go this long way and ensure that all the barriers will eventually be removed to really enable the full participation of people with disabilities in our societies and our economies. Thank you.
Thank you, Sharah. Just some closing comments, closing remarks from the International Disability Alliance. Based just on what you've just said, we are committed as International Disability Alliance to working with everybody, to cooperating with all the development agencies and governments. And before I close and thank everybody, I just want to highlight some of the key elements raised by the organizations from the different OPDs from the different regions. And the first thing that was common to all the inputs that we received from the regions was the human rights-based approach. The second one, call for inclusion. My colleague Nawaf Kabara from the Middle East also mentioned the end to violence, all violence. And then the one that stood out most was the need for disaggregated data. This came across from all the presentations that we received. So now finally, I want to thank the Asian Development Bank, the Australian Department of Foreign Affairs and Trade, GIZ, HelpAge, the Joint SDG Fund, UK FCDO, UNESCAP, the World Bank, UNPRPD, NORAD, and the EU, all the speakers, interpreters, the team at the Social Protection Organization, and the participants. And thank you very much. I hope you have a great weekend ahead. With that, I want to close the conference. Thank you very much. Bye-bye.
Bye, thank you.
Bye-bye.
Thank you. Bye-bye.
Bye-bye.